Hello, my name is Nastasia Dumerville, and I'm going to be your nurse for today. And I wanted to know if it was okay if I did a abdominal assessment on you.
Yes, it's okay.
Okay, so I'm going to wash my hands and I'm going to put on gloves. Then I'm going to check your wristband. Can I get your name and your date of birth?
Kara Johnson, 07/18/2000.
Okay. All right. So to start off with your assessment, I'm going to be asking you some questions. Okay. Have you experienced any type of pain?
No.
Okay. Have you experienced any type of nausea, vomiting,
No.
diarrhea?
No.
Okay. And how often do you go to the bathroom?
Probably twice a day.
Okay. And when was your last bowel movement?
Like 30 minutes ago.
Okay. And what was the color of your stool?
It's brown.
Okay. Also, if side note, if I did have a patient that was experiencing pain, I would ask questions with the OPQRST, O for onset. O for onset. I would ask the question, what were you doing when it started, and when did it start? For P is provocation, and I would ask the question, what makes it feel better or worse? Q is for quality. I would ask if the pain sharp or dull. R is radiate. I would ask, do the pain move or stay the same place? S is for severity. I would have the patient rate the pain from zero to 10. Then time is there any time of the day that the pain starts? Also, I would have the patient point to where they're experiencing the pain. Okay, so back to my patient. Okay, so have you had any history of abdominal surgery or any GI X-rays?
No.
Okay, have you had any? Are you on any type of diets, or you have a tolerance to certain type of foods?
No.
Are you on any type of antibiotics or anti-inflammatories?
No.
Okay. Yeah, I think that's it. Okay. So now I would actually start my assessment. Okay. And one more question. Do you have a history of any type of cardiac or high blood pressure?
No.
Or anything like that. Okay. And so before I do my actual assessment, I would let the patient get up and use the bathroom. And then once the patient come back, I would cover the patient's bottom half, expose the abdomen, and I would cover the patient's bottom half. Okay. And the first thing I'm going to look at, I'm going to inspect and make sure there's no scars or sores on the abdomen. I'm going to check for the smoothness and the softness. Also to make sure that there's no distension in the abdomen. Okay. The next thing that I would do is I would divide the abdomen in four quadrants. And this would be the patient's right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay? So after I would inspect, if the patient had an NG tube at this time, I would take out the NG tube before I palpate or auscultate. Okay. So, I'm not going to do the percussion. I would forward through the percussion. But to start with the auscultation, I would listen with the diaphragm. And I will start in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And what I'm listening for the bowel sounds to check and see if they're hyperactive or they're absent. And if for any reason I don't hear any bowel sounds and they're absent, I would wait and I would listen to the bowel sounds for 5 full minutes. Okay. Now I would palpate using the tips of my fingertips, and I would do right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And did you feel any type of pain or anything when I did that? Okay. And I also I would check for rebound tenderness, and I would press and see the stomach come back up. Okay. One more question. Have you experienced any type of edema or anything like that?
No.
Okay. All right. So now I am done with your abdomen assessment. Make sure you're comfortable. Make sure your phone is by you. Do you need anything?
No, I'm okay.
Okay. And thank you. And if you need anything, just give me a call, okay?
Thanks.
Okay.